Okay, everyone, we're gonna get started. I can see that people are still logging on, but that's great. I'm amazed we already have 200 people on the line. So really excited to have you here today. So today we're really lucky. We're gonna have Dr. Dyann Wirth talking about work in malaria and some of the downstream impacts of COVID-19. This is part of the Broad Global Health Initiative, and it's a series we're going to be having. We are hoping to have every few weeks a talk about different aspects of COVID-19 and different areas around the world that it's impacting, and to bring our collaborators into this conversation too. So getting started, Dyann Wirth is a professor at the School of Public Health. She is the director of the Defeating Malaria Initiative at the School of Public Health. At the Broad Institute, she's an institute member. And she's been working in malaria research and more recently in policy for more than 25 years in malaria endemic countries. And today she's going to be talking about and wearing an additional hat of hers. She is chair of the World Health Organization Malaria Policy Advisory Committee. So briefly, I'm going to switch to the next slide. So just some housekeeping. We're recording this session and we'll be able to share it later. And so we're going to have people submit questions via the Q&A function. And then we'd like you to upvote your favorite ones. And so after Dyann talks, we're hoping to have about half the session time for Q&A after that, and we'll be working on that. I'm going to be trying to unmute you and asking you to ask your questions out loud, and if that doesn't work, then I'll just pick the questions and ask Dyann those out loud. But we'd love to hear from people. We're really lucky, as I said, even when I just last checked, we have people tuning in from all around the world. And luckily, Dyann's colleagues are joining from different parts of the world. And so it's really amazing to have such a diverse audience here. And next slide. So really briefly, so my name is Ann Stevenson, and I work at the Broad Institute and also Harvard School of Public Health. I am part of a group of people at the Broad who are helping put together the Broad Global Health Initiative. It is a group that we're trying to pull together because there's so many different aspects of the Broad all over the world. And really sort of the mission behind the group is that we really want to leverage the excitement and the people who are interested in the Broad in public health and also global health. And really the Broad is global. Broadies represent, and they come from over 50 different countries. And there's a lot of people that are passionate about this work and have a lot to contribute. And so we want to be able to leverage that and engage people within the Broad. We also are really trying to think about how Broad Broad can do better. We have collaborations in more than 80 countries with different colleagues, and so from logistics to operations to improving the science, those are all questions that we ask ourselves. And then what is the space that really Broad can uniquely bring to some areas, particularly in the expertise of genetics and genomics, and thinking about public health and global health along those lines. So this is something that we would love more people to be a part of. If you have questions or want to give input on future talks, please shoot us an email at global@broadinstitute.org. So on that note, I'm going to hand it over to Dyann. Thanks so much.
Great. Well, thanks, Ann, for that wonderful introduction, and hello to everybody from various parts of the world. Today, I'm going to talk about wearing my hat as the chair of the Global Malaria Advisory Committee at the WHO. And so just to give you a sense, I thought I'd just give you a bit of an overview of the WHO Global Malaria Program and the role of the Malaria Policy Advisory Committee. So we advise both the Technical Global Malaria Program Secretariat at WHO in the areas of policy and in specific technical topic areas as noted here. So this, in this role, we really are an outside group of advisors that provide input to the WHO at the highest level. And so as you know, in the COVID-19 crisis, could we advance the slide now, please? The next slide. Thank you. Malaria is potentially one of the many knock-on effects of COVID-19. And malaria could make a comeback in a very significant and serious way if there's disruption in health services in particular. And we historically know, if we can go to the next slide, that during the Ebola outbreak in West Africa, now a few years ago, the analysis of that outbreak indicated that the increased deaths due to malaria may have exceeded those due to Ebola in that situation. So again, this is very important. In the next slide, just to kind of put you in a place where we are with malaria. And this is really the global health organization, the global health expertise in the world, really has focused on eradicating malaria. It's an audacious goal. This was led initially by Bill and Melinda Gates of the Gates Foundation, and then really taken up by the World Health Organization, all research organizations and implementation organizations around the world. And so, next slide, please. The World Health Organization, the Global Malaria Program, developed a technical strategy for achieving eradication. And as you can see on the left hand of this slide, in fact, there was dramatic progress in the reduction of malaria cases from the early 2000s all the way through the 2012, 2015 timeframe. And that included wide-scale distribution of insecticide-treated nets, which are preventing, malaria is a vector-borne disease carried by mosquitoes. And if people sleep under these nets, it prevents the mosquito from biting and transmitting malaria. So prevention through vector control. And then the deployment of rapid diagnostic tests and effective anti-malarial therapies, the most common of which are artemisinin combination therapies. And the broad deployment of these across all countries where malaria was endemic led to dramatic reduction. So there are pillars to the global technical strategy, including getting universal coverage of treatment and prevention, developing good surveillance systems, and accelerating efforts to eradicate malaria. And so there was significant progress. Next slide, please. However, and you can see here that these were among the goals of the global technical strategy. There were many countries where malaria was near elimination, and the goal by 2020, which is this year, was to eliminate, so that's points 3 and 4, eliminate malaria in countries where malaria was transmitted in 2015, at least 10 countries, and prevent reestablishment. So we've done very well there. However, the progress in reducing malaria cases beyond 2015 has stalled somewhat. And that is in part due to the fact that that getting and distributing preventive measures throughout the disease-endemic countries took time, and it also is a challenging. It's a challenge to complete this in every country. And in fact, if we look in more detail in the next slide, you see that, in fact, in a very small subset of countries, 11 countries overall, contribute greater than 70% of the global malaria burden. 10 of these countries are in Africa and in sub-Saharan Africa, and then in addition, India in the Asian region. And so, next slide, please. The Global Malaria Program, advised by Impact, has really moved to focus on identifying ways to accelerate malaria control in what are called the high burden, high impact countries, these 11 countries that are really representing 70% of the malaria. In addition, the Global Malaria Program has focused on those countries on the other end of the spectrum that are near elimination, and formed what's called the E2020, or Elimination by 2020, and there'll be a new Elimination by 2025 launched during this year. So there's really focused efforts on getting to eradication. The progress each year is reported by the Global Malaria Program in the World Malaria Report, and you can find all of these documents on the WHO Global Malaria Program website. However, now we face COVID-19. Next slide, please. And with COVID-19, the WHO has urges countries to ensure the continuity of malaria services in the context of the COVID-19 pandemic. And this was in response to countries that were planning to scale back planned malaria prevention, diagnostic, and treatment activities because of the COVID-19. So WHO really recognizes that it's important to protect the safety of frontline health workers as a primary concern. However, it is also extremely important to continue malaria malaria services, prevention services, because of the risk of increased malaria cases and deaths if these services are interrupted. And so in the next slide, the World Health Organization is really jointly addressing endemic malaria and pandemic COVID at the same time. We're sounding an urgent call, modeling, which I'll talk about in a moment. Modeling the potential impact is very important to understand where particular changes or where particular new scenarios, what kind of impact they would have. Delivering guidance, the World Health Organization Global Malaria Program has delivered detailed guidance for national malaria control programs on how to deal with the COVID-19 epidemic and still be able to deliver malaria prevention and treatment services. And the Global Malaria Program has aligned with the many partners working in this area to try to have a single message and work stream. In the next slide, this is a sort of diagram of the cross-partner work streams that are currently ongoing: clinical trials, surveillance and clinical epidemiology, supplies and commodities, we'll come back to that a bit at the end, malaria response and guidance, communication, coordination, and resource mobilization. All of these need to be coordinated in order for us to be able to both deliver malaria services and deal with the COVID-19 pandemic. So in this slide, I'm going to talk about a report that was released by the WHO last week based on one of the work streams coming out of this joint effort with many partner organizations. And this is the modeling. This is the potential impact of the burden of malaria due to severe disruptions. This is a modeling analysis. In the next slide, you can see, and I won't go through this, this report is available on the WHO website, it's publicly available on the WHO website, but the group of modelers from around the world modeled several different scenarios, going from the least disruption in scenario 1 to the most disruption in scenario 9, and looked at the impact both on cases and on deaths. In the next slide, you see the tweet that went with the release of this report just in advance of World Malaria Day. This report was released on April 23rd, and World Malaria Day was this past Saturday, April 25th. The Director General tweeted, the modeling analysis reinforces WHO's calls for maintaining essential life-saving services to prevent, detect, and treat malaria during COVID. Next slide, please. So you can see the results for the different scenarios, with the most disrupted scenario, that is the reduction by greater than 75% of both a routine case management for malaria and distribution of bed nets. And you see that the number of deaths increases. This is across sub-Saharan Africa, approximately twofold, increases by 100%. And so a dramatic impact. If we go to the next slide, you can see that the impact in different sub-Saharan African countries is stratified. This is related both to the level of transmission, but also the proximity of distribution, large-scale distribution of bed nets in proximity in terms of time. Now, many of these countries are where we have global broad partnerships, and I think the next slide just circles those. Yes, so this includes many of the countries in this group of countries that are going to have severe impact if malaria prevention and treatment services are disrupted. So in the next slide, I'm just showing a couple of examples of countries where Broad has significant activities. Here is Nigeria, where under scenario 9, you see a doubling of deaths, and these deaths are all in children under 5. In the next slide, you see Senegal, another country where I personally have had a very long-term set of collaborations. And again, a very large increase. In the next slide, this is just, we were just, in fact, in Senegal to launch a genetic epidemiology scale-up for countrywide detection of malaria using genetic approaches. And this was a picture from that in early February. So just before really the realization of this COVID pandemic and the massive beginning of transmission. So in the next slide, I just wanted to kind of summarize and look back. This graph is actually from the global technical strategy I mentioned a little earlier. And this is kind of looking at the possible trajectories of malaria, the number of cases, I think, in this case, in whether, sort of following the projections of WHO global technical strategy in the green line, the actual on course, as I told you, we stalled a little bit in the mid, just around 2015. But if you look in the red line, this is where services for treatment and prevention of malaria are in fact not kept up to their current levels. And in fact, you see this incredible rebound. And let's just translate that for a second into lives. In the next slide, this means a projected around 400,000 deaths due to malaria in Africa in the 2020 year. But with COVID-19 and the potential disruption of services, this could almost double. And that means over 750,000 children under 5 dying due to malaria. And this is something that I think as a global health community, we want to prevent. Okay, in the next slide, I just want to say a few words about chloroquine and hydroxychloroquine for COVID therapy. Well, and I'm just going to take a little bit of my coffee. I hope you're all having coffee in our coffee break. So as many of you who have been reading the paper and the popular press, have been hearing about chloroquine as a treatment for COVID-19. Now, let's just go back historically. Chloroquine has long been used as a treatment for Plasmodium falciparum malaria and is the current treatment for P. vivax malaria. Most falciparum in the world, except in Central and Northern South America, is chloroquine resistant, but it's still a very effective drug for Plasmodium vivax, one of the human malarias. These drugs specifically inhibit the parasite biology. The parasite uses hemoglobin. Remember, the parasite exists in a red cell. It uses hemoglobin as its source of amino acids, and chloroquine interferes with that process within the parasite. So chloroquine directly targets the parasite. Next slide. Let me contrast this with coronavirus, with the mechanism for viruses. So for coronavirus and other envelope viruses, the mechanism of chloroquine inhibition is an inhibition of the host cell function. And if you look in the third panel, you can see that, and I'm not sure, you can't probably see my pointer because I'm not sharing my screen, but it essentially, chloroquine interferes with either the uptake of the virus into the host cell or the production of the virus, because it's able to change the pH of particular parts of the host cell which are critical to virus development. So this is different that if you look on the left-hand side of this slide, where drugs that directly target viral functions, those have a different mechanism. So the chloroquine mechanism is in fact on the host cell. And so in fact, chloroquine does in an in vitro set of experiments inhibit the COVID-19 or the coronavirus, the whole group of coronaviruses, from replicating in cells. This is also true, that is, chloroquine inhibits a whole host of envelope viruses through this same general mechanism. So the idea of using chloroquine to treat viral infections is not new with COVID virus. In fact, it's been tried with a fairly large number of envelope viruses. Previous trials for influenza, for example, and other viruses, however, have showed no evidence for chloroquine effectiveness in preventing infection or changing the course of disease. And while we can't say that by transitive property, the same thing would be true for coronaviruses, I think this should give one pause. So in the next slide, let's just talk about the current status. So in some ways, chloroquine is a known drug that has been given to millions of people over decades. So it's registered and it's possible to use off-label. However, there are known side effects of this class of drug, well-known side effects. Most relevant here are the potential cardiac effects. And in fact, in two open-label trials, at least two open-label trials, and perhaps others, one in Brazil and another one at the VA, these have been stopped because of cardiac-related deaths in the chloroquine arm of the studies. So current NIH, WHO, NIH, and FDA guidance does not recommend using either drug until the results of gold standard clinical trials are completed. This is the standard way we evaluate drugs for their use in treatment of any disease. These clinical trials are underway to test both chloroquine and a related compound, hydroxychloroquine, in COVID-19 patients. These are gold standard controlled clinical trials coordinated by WHO, NIH, Gates Foundation, other organizations for treatment. The initial results of these will be available sometime in the June timeframe, and then I think a scientific evaluation using evidence will be able to be used. Of course, there's a second issue here, and I mentioned this in my introductory remarks, namely that there is a challenge of the global supply of chloroquine. As I said, the drug is primarily being used to treat Plasmodium vivax infections. It's the second most prevalent Plasmodium infection in the world. There are hundreds of millions of cases each year. But the demand, if this drug is going to be used for COVID, of course, will be much higher. So there's an issue of global supply, both for use with COVID patients, should it indeed work, but in addition to maintaining its use as an effective anti-malarial drug, where it is currently part of national malaria control programs. So that represents yet another complexity of this. So in the next slide, I just wanted to finish with a tweet just before World Malaria Day from Pedro Alonso, who is the director of the Global Malaria Program and a close colleague. Whenever health services are disrupted, malaria becomes the main killer. Malaria cases could double because of COVID-19. So I think that's the message, and I'm happy to take questions. And I think the next slide, we're going to go back to Anne.
Thank you so much, Dyann. That was amazing. And so I am, again, just reminding people, we'd love to hear your questions. Submit your questions through the Q&A function at the bottom of your screen. And I'm going to do my best to try to reach out to people and have them be able to say their question out loud. And when you do introduce yourself, we'd love to just hear your name and where you're from before you ask your question. Okay. Jane Wilkinson, I am going to do my best to try to unmute you so you can ask your question. One second. Oh, okay.
Hi, everybody. Can you hear me?
Yes.
Hi, this is Jane Wilkinson, and I'm in the genomics platform at the Broad Institute, and I've been working really closely with the Global Health Initiative. My question is, I'm sure this is on a lot of people's mind, is what's the potential impact of Trump's decision to pull out of the WHO funding? And not just its impact on the COVID response, but also the impact it will have on our malaria response as well. Thank you.
Thanks, Jane, for that question. I think it's safe to say that, as many global health leaders have come out to say, this could be devastating. The United States, both financial contribution, but also commitment to a collective way of dealing with global health problems that affect the entire world. And I think it is. I encourage everyone to, if they feel that way, to write and express their opinion about how important WHO is. Countries really look to WHO for guidance, as you see in this malaria and COVID-19 coordinated response. WHO has become very nimble in being able to respond quickly and to have an authoritative, evidence-based set of opinions. And in this time when many decisions seem to be made on opinion and not really evidence, I think it's important to have an organization like WHO, which is both has a very strong technical staff housed in Geneva and in the regional offices, but also draws upon the expertise of people from all over the world to help solve these pressing problems.
Thanks so much, Jane. Dyann, I'm going to repeat a question that someone had. Can you speak at all to some of the other aspects that WHO is driving within the COVID response, even outside of even malaria?
Well, I think, again, there is a really concerted effort to look at the impact of COVID on many diseases, particularly the infectious diseases that require both a prevention and treatment arm, which means that disruption of health services could have an immediate effect on the ability to both vaccinate children, to be able to deliver key health services. But as you can imagine, issues around maternal and child health, anything where health services is disrupted is potentially at risk. And there's a major effort at WHO to look at all of these as holistically as possible, bringing in, again, the technical expertise as needed.
Thanks. I'm going to go to Shantha Kumar. I hope I am saying your name a little bit right. And I'm going to ask you if you can ask your question, Dyann, about quinine.
Hi, Dan. So I'm one of your students also, so glad to see you. So I have finished that malarial program in EDAX. So I'm working in vector control for more than a decade. So we are actually looking into some kind of adverse drug reaction in your previous slide. So with the chloroquine. So in that case, how can we use this against COVID? Will that be a problem? How do you see that?
Yes, I think that one of the issues, there are well-known side effects of the immunoquinoline drugs, which includes chloroquine and hydroxychloroquine. They have been used in millions of patients, and so the side effects are well known and they need to be monitored. And so it is possible the drug is used. It's, as I say, it's used in the treatment of malaria. It's also effective in the treatment of inflammatory rheumatoid arthritis. So it can be given to people, but they must be monitored. I think the important thing before it's used for COVID-19 is a demonstration of the effectiveness. If the drugs are really not effective either in preventing or changing the course of the COVID-19 disease, then exposing patients to that increased risk, even while monitored, seems unadvisable or not advisable. Thank you.
Dyann, I'm going to ask another question on behalf of one of the people in the audience. Are there any countries that are doing particularly well in terms of their COVID response that might be able to be something that other people could watch in the leads that they're taking in terms of gains made in malaria eradication and what they're doing in their COVID response?
Mm-hmm. Yeah, I think that one of the things that's pointed out in the recent global malaria program guidance is that, in fact, the gains and the systems that have been established for malaria eradication could very well be deployed in aid of COVID-19 prevention, particularly prevention. And so I think in the case of malaria eliminating countries, for example, there's a requirement that each case be investigated, contacts be traced, and so forth, or because it's a vector-borne disease, it's a slightly different mechanism. But the idea is each case needs to be investigated. This is something that's clearly important in COVID, and the countries that have successfully used that, such as Singapore or South Korea, have in fact seen less impact of COVID. So there's certainly some learnings there. At the moment, I think the strength of the public health systems will be a strong determinant in the COVID outcome.
Great. I'm going to hand it over to Michael Reich right now about projections and rising malaria deaths.
Hello, Dyann.
Hi, Michael.
So the projections about rising malaria deaths seem to be based solely on expected disruptions in the health services and control activities.
Yes, that's the model, yeah.
Do we know anything about the biological interactions between COVID-19 and malaria in increasing susceptibility to infection or increasing mortality, as we see, for example, with diabetes or heart disease?
Yeah, that's a great question, Michael. And I think that's something that indeed research is being launched to look at potential interactions, biological interactions or immunological interactions between COVID-19 and malaria infection. So for example, since malaria is most deadly in young children under 5, and COVID-19 seems, at the moment at least, not to have in countries where malaria is not a major problem, doesn't seem to have as big an impact, at least in child mortality. The question will be, in children that are already compromised by a malaria infection or a recent malaria infection and have, for example, anemia, are they more susceptible to COVID-19 deaths? And I think a very important question, and one that is actively being addressed, coordinated by both WHO, NIH, and the Gates Foundation, among others.
Great. Mamadou, I am going to hand it over to you. Can you ask your question?
You might have to unmute.
Mamadou looks like, let's see. Oh, you're unmuted now. Can you ask your question? Can you hear us?
Hello?
Yes, we can hear you now.
So, as many countries are implementing the lockdown, so in the long term, that will have an impact of the reduction of the exposure to malaria vector bites outside, especially in the evening. So we will expect the malaria incidence might decrease also. Have you taken into account in your scenario?
Well, this is, in sub-Saharan Africa, the major vector species, Anopheles gambiae, bites indoors and in the evening. So in fact, keeping people inside in the evening and through the night, keeping people inside if they're not under insecticide treated nuts might actually increase transmission. In the modeling, the main considerations, as Michael Wright pointed out, was really looking at disruption of health services, both routine health services and campaigns to distribute bed nets.
So I think we have time for one more question. It is 2:42 right now. I am going to hand it over to Rebecca Mant. Rebecca, can you hop on and ask your question about public health priorities.
Great. Thank you. Hi, Dyann. This is, of course, a really convincing and important presentation, but my question is, in a resource-limited setting, one can imagine there may have to be some trade-offs in public health priorities, and we're even seeing discussions in the United States about having to maybe ration healthcare and make trade-offs. And are these types of discussions also happening at WHO, and if so, what are the different policy, public health, and ethical issues that are being considered in terms of how to balance these different priorities?
Well, yes, thanks, Rebecca, for that question. Clearly, that's a very important question. And I think, you know, again, the really protection of human life is at the sort of pinnacle of considerations. And so I think in particular in malaria, where, you know, the modeling and the thinking really indicates potential major increase in the number of deaths in young children, I think that will in some ways help drive the decision making in a resource poor setting. You know, I always hate to pit diseases against one another, because of course if you don't vaccinate young children, the same kinds of issues come up. And so I think, but it's very important to recognize that in this kind of situation, a protection of human life and the most vulnerable life is an extremely important consideration, and comes into discussion in every aspect of this. And I think the goal is to, as efficiently and rationally, maintain measures that will protect human life from dying from malaria, while at the same time limiting both healthcare worker exposure to COVID, and preventing, you know, not having a campaign actually increase the spread of COVID by using personal protective measures. So it's a very big issue. There are not easy answers to this.
Thank you so much, Dyann. Thank you so much to everyone who joined. So once again, we would love to hear from the people that tuned in today, and we're gonna try to have regular coffee breaks like this to be able to have more Q&A. We'd love to hear from you in terms of regions of the world you'd be really interested in hearing about, or potential topic areas. Feel free to email us at global@broadinstitute.org. And thank you again to Dyann.
Good, thank you.
Thanks, everyone.